today I'm going to demonstrate the post-operative preparation on a patient um, done who has done a surgery. So first you have to know about is the personal data. So you have to know about the personal data first, and then you have to know about the under the personal data you have to know about the patient's weight, and for transport, then you have to know about this transport to PAU, PW or ICU. And then the surgery, you have to know what type of a surgery have been done to the patient. And then you have to know what so first visit where he was, and all those things. So the next one is the consciousness. You have to check in the patient he's conscious or not. And then you have to look whether um so consciousness, you have to check maybe 30 in 15 minutes. You have to check also if it's so, or else you have to check in hours. So in the so at the time of report you have to know whether the patient is conscious or not. And then you have to know whether about the vital signs such as pulse, as I have mentioned here, and respiration. So what kind of what respiration, what is the respiration at 7 a.m, 8 a.m, 9 a.m. So in this chart it's demonstrated in this way. So and in next vital sign you have to check is the BP, that means the blood pressure. So the next one is the again the consciousness. You have to check. So previously we checked the conscious maybe 30 to 15 minutes, in each 30 to 15 minutes. So here you have to check the consciousness by saying, you have to give more motor commands like, can you hear me, can you feel, where are you, and where do you feel pain. Those things you have to check. And so sometimes maybe in the first 2 hours the patient is not conscious, and the consciousness is negative, it has mentioned here. So in the next hour it is mentioned as positive. So next you have to consider about the temperature of the patient. So in the first hour you can see it's reported as 37. So normally for a post-operative patient this temperature is kind of normal, because he has undergone a surgery. So for a patient who has not undergone a surgery and who's doing very well good, they are having a temperature of 36, like. So this temperature is really so this is the normal temperature for us, because we are healthy, we haven't undergone surgery, and we are currently doing well. So for a patient who has just undergone a surgery, so in a post-operative patient, this temperature is normal. And the next one, it's you have to check the skin whether it's pale, blue or normal. Normally you have to check whether it's pale or blue or normal. And next one, you have to check whether the intravenous access is available. So IV line is available. For this one you have to check by connecting an IV line to the vein, and using a saline or any sort of solution, glucose solution you can make, get into consideration, and check whether IV line is normal. And the next one, you have to consider about the site of the surgery. So the site of the surgery, you have to consider whether it is having any sort of hemorrhage, and the state of the dressing and the inflammation. Is there any red color, swelling or pain, or any sort of local heat in the area? So If they're so, he must be again undergone some sort of medications. And the next one is, you have to check whether the patient is vomiting. If the patient is vomiting, all you have to do is to tilt the patient's head, probably the patient's head. Tilt means turn around it to the side, so that he can easily vomit out, and or else vomit out to the vomit out to the environment, or any sort of basin just next to his bed, or you can use any suction pump. And also you can check for drain losses. And also the next one you have to check is the NG tubulosis and wound drains. And the next one you have to check about is the urine observations. In the urine observations, you have to check about is the color of the urine, and the concentration, the presence of stones and blood in the urine. So sometimes there may be blood in the urine in a post-operative patient, such as a patient who have done nephrostomy. The You have undergone a surgery in the kidney, and you can find blood because you have cut the tissues over there, so the kidneys are already filtering blood over there through with the water. And the next one, it's the concentration. You have to check whether it's normal or not, and the presence of the stones of the patient's urine. And next one, the blood. The last one is blood actually. So it's this, you have to check all these things together. So the catheter type, you have to observe what type of a catheter. If you know, when the patient is said that he has no requirement, he has no urgency to pee before the operation, you apply a catheter to the patient. You put on a catheter to a patient so that the patient does not pee, so that the if the patient having any urgency during the surgery, he may pee into the catheter. So you have to report what type of catheter was put. It's a Foley type catheter, French, or suprapubic, or nephrostomy, whatever. So the next one is the volume of the urine that have been excreted. So the volume of the urine may suggest you what type of a complication he may have having sometimes, or maybe he's having polyuria, so some sort of anuria, oliguria. So this thing you have to consider. So that's it for the post-operative preparation. So just suppose a patient is having patient is unconscious first time, and then having a pulse of 80 and respiration 16 and the blood pressure 120 in the first hour. And then the temperature is like 37.2 or 37.3, and the skin is normal, and the intravenous access is normal, and just a little bit of hemorrhage in the urine, and no vomiting and other things are normal. So what kind of a conclusion you can get through this? So for me, if the person was presented, I would say the person is normal. But actually the answer is also the patient is normal, because I couldn't tell you the type of the surgery if the patient has undergone a nephrostomy surgery. So the person has undergone a nephrostomy surgery, and he's bleeding with the urine, so that's normal because you have cut the tissues around the kidney, so near the kidney, so it's already filtering blood with the urine, so this is normal. So hope you got something from this video, and until the next video, stay safe. And um, I guess this was quite a good explanation for all of you. Thank you.